Good afternoon, everybody. Good afternoon. Thank you all for coming this afternoon. My name is Derek Dizzy. I am your town manager. As you all know, I think while you're all here today, we have a special guest. U.S. Senator Elizabeth Warren is with us, and she'll be out here in just a few minutes. But before we begin, I just want to recognize a number of folks that are in the room today. To the right over here, we have Selectman Bletzer and Selectman Canty. Representative Lenatra over here. I'm going to pause for a minute because Rep. Muratori is in the back, and before any claps, please, it's his birthday today. It's his birthday today, okay? So I want to make sure we all acknowledge Rep. Muratori's birthday today. Secretary of Elder Affairs, Secretary Chen is here. Betsy Connell, Director of the Council on Aging for Massachusetts, is here. Super Phenom Amy Naples, Chair of the Senior Task Force, Chair of the Cal Advisory Board, Executive Director of Chamber of Commerce is here. And then Michelle Brady, who's probably already left. I think you guys all know Michelle. So I want a special thank you to Michelle because she's done a great job organizing this as she always has. So again, thank you all for coming. And at this time, I'm going to turn over the introductions to our very own Senator Sue Moran.
Thank you, Derek. Let me know if you didn't get him. Boy, this is big. This is really special because this center, it happens to be the one in my entire district that gets the visit from Senator Warren, and that is and to be greeted with incredible patriotic songs and flags and decor, and you know, we just do it right in Plymouth. So I have the incredible honor of introducing Senator Warren, who has really been a true champion for seniors. And I've got to express my gratitude to her, in particular in the federal delegation, for the incredible partnership. No issue is excluded. Every single thing that Representative Muratori and Lenatra and I work on, we get an incredible responsiveness from Senator Warren's office, and we really appreciate that. I think you remember Senator Murray, Plymouth Harbor getting dredged. That's an example of the benefit. Safe decommissioning for the Plymouth nuclear power plant. We work together on that on a certainly weekly basis. She has been leading in Washington, removing barriers from healthcare. She is the lead in Over-the-Counter Hearing Aid Act. How many people have been able to benefit from that? I think you'll hear more. She understands, well, I know, all right, pun intended. I wanted to, okay, raise your hand if you got that. Thank you. I'll be singing happy birthday if one more, and you don't want that. You don't want that. Senator Warren understands the key issues affecting seniors. She is the push for expanding Social Security by an impressive $2,400 a year. That's money in your pocket. Importantly, extending the solvency for senior citizens for 75 years, it's going to be there to provide that security for all of us. She has had a key role in the negotiations on the Inflation Retention Act so that the government can work for the people, not just special interests. She is partly responsible for raising $200 billion in corporate profit minimum taxation and for being sure to restore the IRS Act for enforcement on high income and corporate taxes, which of course keeps our burden lower. With Senator Warren's unwavering dedication, we are assured that seniors have a formidable warrior. I want to thank you all for being here. It's incredible to show how much Plymouth cares, how important and powerful Plymouth is. Thank you very much.
Hello, Plymouth. And hello, Aretha fans. That's the best part. Yes, yes, go. It is so good to be here, and I appreciate the introduction, Sue. Always very generous, and I very much appreciate it. I also want to say a very special thank you to our state reps who are here. That we've got Kathy Lanatera. Where are you, Kathy? Stand up so everybody can see you. And Matt Muratori, whose birthday it is today. Happy birthday. Happy birthday. So I'm so glad to be here with you. Michelle, where did Michelle go? There she is. Thank you very much for having me here. The center truly is a remarkable place. I mean, just amazing. And I'm just really delighted to have a chance to be here. I thought what we do is I just talk for 2 or 3 minutes about some of the things that may be important to you. I hope they are. And then I'm going to introduce someone who's going to talk, and if we have a little time left, maybe we can do as many questions as possible. I'm always glad to talk about whatever you'd like to talk about. So what I wanted to start with is to think about economics. It's the key part of what I do, and how we build a secure economic future for everyone, how we build out our middle class. And for me, a really significant part of that is we need fairer tax laws and more investments in the kind of things that keep people up and going. I was really frustrated this year with the fight back and forth with our Republican colleagues in Washington over the debt ceiling. And the initial cuts at that was that they were going to try to reduce the federal debt, and we do have a serious problem with the federal debt. There are many things we need to do, like raise revenues to help pay it off, but reduce the national debt by cutting Social Security. And Social Security and Medicare were at the top originally of the Republican list, and I have to say, I want to give credit to President Biden, who just stood up, if any of you watched it, when he did the State of the Union, and he called out that this had been the Republican plan, and somebody yelled, "You lie!" And he said, "Great, you want to do a deal right now that you're not going to put Social Security on the table?" And by golly, it worked. So the good news is we were able to get through the whole debt ceiling fight without any cuts to Medicare, without any cuts to Social Security. Yes. Good, but I just want to say not good enough. I have a bill with Bernie Sanders. He and I are the Social Security caucus in the United States Senate. And caucus, I think, is a Latin word for going around irritating everybody else on any particular topic. And on this one, I just want to point out, we have got a bill that basically just says, as you get richer with Social Security, you still have to pay more in taxes as your income goes up. And the consequence of our bill would be twofold. The first one is it would assure Social Security payments and the system would be entirely financially independent throughout the rest of the 21st century. That would be part one. And then part two is it would raise Social Security payments for everybody by $200. So we're out there pitching it because I think it's the right thing to do. I want to mention a couple of other things too, though, that I'm working on right now and things we've gotten done. We passed the Inflation Reduction Act last summer. It's 11 months ago now, 10 months ago now that we got this thing through. And it has some really crucial differences. The first one is that this is something I worked on a 15% minimum corporate tax. Now, I'm going to be really dorky for a minute here, but I love dorky. I'm going to speak out to the policy wonks in the room. We have a significant number of corporations in this country that go out and report to their shareholders $1 billion or more in profits. I'm talking about profits after they've covered all their expenses, and then turn around to the IRS and say, but I owe nothing in taxes. And we have played this game for years now. They have lobbied in so many loopholes. Now, I get it. Congress let them do it. But has lobbied in so many loopholes that you've got companies like Amazon, a couple of years ago, reported $11 billion in profits and paid zero in taxes. So I started pushing this idea of a 15% minimum corporate tax that is assessed on how much you report in your public documents as your profit. So if you're going to go tell the public that you are this profitable, you're going to have to pay at least 15% if you're above $1 billion in profits. We got that through as part of the Inflation Reduction Act, and then used all of the money from that to do two things. The first one is to pass the biggest climate package in the history of the world. So we're going to have that money going into climate. And the second is to start working on issues around how seniors pay for health care. So what is also in the Inflation Reduction Act, for the first time ever, the United States government will be negotiating with, it only starts with 10, but you know, a start is a start, with 10 drug manufacturers to reduce the price of prescription drugs. In addition to that, we managed to get into that bill $35 insulin. Nobody pays more than $35 a month for insulin. And part 3 is nobody will pay more than $2,000 a year total for all of their prescription drugs. So, and they're just starting to roll in on these. So these are just starting to come into effect. We've got $35 insulins in effect now. Next month will be the announcement, this is still June, it'll be in August, will be the announcement on where we are on the negotiations, and the $2,000 cap starts in 2024. So we're getting the pieces in there, and it's just a way to be able to say people shouldn't be going bankrupt over healthcare costs. It doesn't cover everything that we need to cover, but for the first time in a long time, it starts to point us in a meaningful way in the right direction. So that's a big deal. Third, you bet. Third thing I want to mention is hearing aids. I started in about 2014, started talking to some folks about why do hearing aids cost so much money? A pair of hearing aids could run $5,000, $6,000 for a pair, right? And yet the electronics are a lot less than an ordinary cell phone, right? They're not nearly as fancy. They're not nearly as complicated. Why do they cost so much? They cost so much because a very small number of companies had figured out how to basically behave like monopolists. They got states to go along, and they got a lot of restrictions on entry. I decided, that is something you can fix, and you can fix it at the federal level. So I got a partner in this, Chuck Grassley, oldest member of the Senate. I figured good one to go for on this. I called him, I said, Chuck, I got a deal for you. He said, what? And I said, hearing aids, we're gonna do hearing aids. And by golly, we got the thing through. Donald Trump signed it into law. Then I have to say the FDA dragged their feet on they actually had to write some regs around it to get it out the door. But as of 3 months ago, you can now buy hearing aids over the counter, $799 for a pair. So, again, not everything we need to do, but some important things we need to do. And the last thing I want to mention is one about accountability. I'm really troubled about Um, when people get hurt and there's no real accountability, it kind of all mushes away on how did bad things happen. And I want to tell you the specific example I'm talking about. It's during COVID. One of the things we discovered is that nursing homes are being bought out by private equity very quietly. They have very nice names, like Sunshine and Puppies, private equity outfit, comes in and they buy the nursing homes, and then you know what happens. They cut staff, they stop checking on people as often, and this truly turns out to have life or death consequences. New study shows that during COVID, nursing homes that were owned by private equity had a 40% higher death rate from COVID than nursing homes that were not owned by private equity. And here's the trick. Try figuring out who the private equity is that owns a nursing home. Like I said, it's called the Puppies and Rainbows, which is invested in by the flowers and happiness, just layer after layer. So one of the things I'm working on right now is to force into the public who actually owns nursing homes in America. We've got to have the names of the real live human beings. If you want to make money off a nursing home, then by golly, you ought to be willing to have your face and your name out there in public. So those are just some of the things that I'm working on right now that I wanted to talk about. But what I also want to do is expand this conversation so that we can also bring in another important partner in all of these fights so that all of our seniors have an opportunity to live with some real dignity, and that is Massachusetts Secretary of Elder Affairs, Elizabeth Chen. Elizabeth, come on up.
Thank you, Senator. Thank you very much. So first, I want to thank this community for what you did to support each other throughout the COVID times, throughout the acute phase of COVID. It was very hard for everybody, and I know this community was right there making calls, supporting each other, and you have been incredibly, incredibly resilient. So thank you very much. And Senator Warren, thank you for your continued advocacy for the well-being of people in the middle class and for people who aspire to become into middle class. And hearing aids, I just have to tell you a personal story. I was a caregiver, I was a primary caregiver for my mother who died fairly recently, and she needed hearing aids for the past 15 or so years. And she was a key punch operator very early on. So you can imagine the $5,000 for the hearing aids, her daughters put up the money. It was impossible. And so thank you for making this possible for others. Again, as I say, people who aspire to be in the middle class. So important. And I also have to put out this message. Don't be afraid to go get your hearing aids. It actually is a very, very healthy thing to do, because the loss of hearing predisposes you to dementia. So get the hearing aids. There's no shame involved, all right? And thank you for your work regarding prescription medications, because the donut hole is such a big gaping donut hole, and you're really, really closing that for us. So we much appreciate for all your work there. So the executive, it really continues to be an honor to serve as the Secretary of the Executive Office of Elder Affairs. This is my 5th year coming up, and I'm a gerontologist, so it is work that is near and dear to my heart, and I want to make sure that the 1.7 million older adults in Massachusetts can live and thrive, importantly thrive, in their communities of choice, much like Plymouth. And so we benefit from federal funding through the Older Americans Act, and we benefit from the generosity of the Massachusetts people through the legislature that then adds another $8 to every dollar of federal funding, which is amazing. We are a very, very, very generous state. And so we partner with the Aging Services Network, like the Councils on Aging and Aging Services Access Points, which we call ASAPs, to do programming that encourage social and community engagement. You know, isolation is dangerous. Isolation is dangerous for your health, and it's also dangerous for your safety. Behavioral, we also partner with the Aging Services Network for behavioral health and emotional wellness supports in the community. We support not only older adults, but your caregivers, who could be spouses, but could be children, who could be nieces and nephews, or you could be a caregiver for grandchildren. So we support all your roles. We also provide interventions when older adults need protection from abuse, neglect, exploitation, and self-neglect. We get 50,000 or so calls a year, and I think that's too many. But I'm also grateful for the calls so that we can investigate, and I think about all those calls that we don't get. So councils on aging, such as this one in Plymouth, are you really, the work that you do, Michelle, you're really on the ground and providing services and supports every single day. And the Healy Driscoll administration continues to recognize the work that you do and the work of others in councils on aging. And so this year, an increase in the formula grant went from $12 to $14. And this will help you continue the work. And it's been included in both the House and Senate. And so we hope that it'll be included in the GAA for fiscal 24. I think this is one that doesn't go through conference, right? There you go. And I want to briefly touch on two programs that may be of interest. The Senior Nutrition Program, home delivered and meals here in the likes of councils on aging and senior centers. We served 10 million meals last year. Now it's not just the meals. These are nutritionally appropriate meals for older adults, but it's also about wellness. Every single meal is also a wellness check because it's eyes on somebody. And every single meal delivered to the home is also eyes on somebody who might be isolated. And meals are delivered by 7,000 volunteers. Amazing. I am so grateful, so grateful for the work of volunteers because we couldn't do it without volunteers. Much like senior centers here, we cannot do it without volunteers. And then there's the state health insurance counseling program, which we call SHINE, and we provide free health insurance information and counseling to all of Massachusetts residents. And this is especially important in Medicare, and with the changes coming up, it will be even more important so that everyone is so much more informed about their best choices for any supplemental plans. And so, I would say that continue to stay involved, bring your friends in. I hear so often, oh my goodness, I'm not old enough to go to a senior center. So not true, so not true. I hope that senior centers will be the nexus for all of us as we go from communities focused around schools to communities focused around work. And in retirement, senior centers should be our communities. And so with that, thank you for inviting me. It is my pleasure to be here with the senator. And let me turn the floor back to the senator.
Thank you so much. Thank you. So anybody have a question? Comment? Yes, ma'am.
I'd like you to talk a little bit about the simplification of the tax code.
Yes. It's not happening. No. So I'm going to take that slightly differently about simplification of the tax code. Yes, we need a simpler tax code. We have another piece of it. This is how I think of it. We, next year, for the first time, are actually going to have a pilot study on Free File. And so this is for people who file an income tax return but want to just do it online and answer a few questions. The IRS says, based on what you've told us and based on the information they already have what comes in on your 1099s or whatever. This is what we believe you owe. If you don't think that's right, that's fine. Just say no, and you can do the regular form, fill it out. You can get help if you want to. If you do think it's right, say yes, and they either send you your refund or you send in what it is that's left. Why does this matter? Let me just stop for a minute and talk to you about why this matters. Why this matters is because lots of people who have pretty simple taxes that they need to file every year are paying an average of somewhere in the neighborhood of around $250 just to be able to file their taxes, and a couple of hours. You got to go somewhere, you got to find somebody, you can bring a bunch of documents, then they say you don't have it right, and then do you want to know one of the number one things the IRS spends money on? You wrote down that your income last year was $54,261, and they have that it was one number off, that the 64 was 46. So they got to send you something back and say it's not consistent with your documents. Here's where we've got a problem. Can you send us your documents? All of that is time and aggravation. And if the IRS puts it up and says, does this look right to you? We are showing you what your documents show. Then we can make this process smoother. And so it has been the law for more than 20 years that the IRS was supposed to do this. Why have they not done it? Because the companies that make money off that $250 over helping people file their tax returns has turned into a multi-billion-dollar industry nationwide. And understand this, it's not about the richest people in America. They're still going to pay fancy people to figure out what all the loopholes are. It's about middle-class families, people of modest income, working families, people who are in retirement and may have a little investment income that they've got to have to report. Those are the people who are paying literally billions of dollars every year just to get someone to figure their taxes. And this is like the lobbyists keep fighting it. And finally, this was actually part of the Inflation Reduction Act, that we got in there the money. The IRS is going to do a pilot project next year, and if that works, we're going to finally move into free file available to everybody. And by the way, I'm pushing for Massachusetts to be one of the pilots. I don't know yet, but I'm pushing. Yes, this is a good thing. Thank you for the question. Who else has got a question? Who else has got a question? Here we go. You know, the problem with a flat tax, I actually believe in progressive taxation, because I believe that as you get richer, the value of your marginal dollars changes. You can only eat so many pizzas, you can only buy so many pairs of jeans. And the difference between somebody who's earning $50,000 a year and someone who's earning $50 million a year, I think they ought to be charged more. Oh, because it's just too easy. And there's a whole lobbyist industry on keeping this complicated. You know, this is one of the things, I'll just say, you run into, because I'm on the finance committee. I like the numbers and like to dig into this stuff on taxes. I talk to people about the way you did it. Now I'm with you. Say, how about if you just say it's just a percentage of your income and don't give me all this deduction and that acceleration and this piece over here. And everybody I talk to says, totally, I'm with you. Oh, except I'm a real estate agent and I really like that mortgage deduction. Oh, but and I really like the deduction we do. And what you find out is for every one of the loopholes you want to stitch up, which is what it takes to get to a flat percentage, there is a bigger constituency out there to beat you up over it than there are people who will stand behind and say, we got to clean this up. And frankly, that's exactly why I went to the 15% minimum corporate tax and jumped the whole tax, multiple volumes of how the tax code works, and said we just got to get out of this, or else we're gonna just choke to death on these tax regulations. So baby steps, but headed in that direction. Yes, sir.
Sticking with the IRS, the House took out the additional money for the IRS. I've also read that it's not going to matter that much.
Yeah, well, your mouth to God's ears. So let me do both halves on this. So remember, the whole reason we were in these negotiations a couple of months ago is the Republicans said the debt, national debt is too high. So one of the things they then negotiated for and insisted on was to take money away from the IRS. The problem here is that for the IRS, they've had their budgets cut. I mean, they are way down from where they were 20 years ago. Population has gotten bigger, tax code has gotten even more complex, and the IRS has gotten even less money. Also, Congress has mandated more monitoring of taxes for people at very low incomes. So IRS has had to devote resources down there. They haven't had the money to upgrade their computer systems. It's just 85 ways that you could have trouble trying to run a big complex system. The IRS has run into that. But here's the number one. As the IRS budget has been cut back, guess who didn't get audited? The richest people in America. The audit rates went down, down, down. And one of the reasons for that is because it takes the auditors who know the most, and it takes a dedication of resources. You may have to work on it for a year or two as you track down how this money moved around the world and transferred into diamonds and then over into artwork and then back into a share of a yacht and so on for this to happen. When the Republicans cut the IRS budget, they cut it at the place, it's about rich people not getting audited. For every dollar that the IRS spends on auditing the top, we, the American people, get $12 back in return. So the consequence of the Republican cut to the IRS, if it goes all the way through, is actually to reduce our overall income, or to say it another way, to make it easier for tax cheats at the top to be able to keep their money. Now, there is a good part to this, and the good part is the money that was in the Inflation Reduction Act to go to the IRS is to be spent over 10 years. They gave us a cut, and it's a bad cut. I do not like the cut, but it's not a cut in today's budget. In other words, it's basically, we gave them enough money for 10 years, and now they've got enough money on their projected for 8 years. So if we can get folks back in there who believe the IRS ought to be auditing rich people, we can actually change it before it has any impact. So that's the one about whether it has a big impact or not. So, can I say this when I have my pen on? I would say, if this were a political event, but it is not, I would say vote for Democrats. Okay, but that's the fight. Because I do have to tell you, that's the fight. That's just factual. Yeah, you're doing that to me because I'm wandering out. And yeah, okay.
Can I ask you a political question?
Sure you can.
Christian Amanpour interviewed President Obama last week. It was broadcasted. And he talked about the fact that a third of black voters could not come up with a single reason to vote for a Democrat. Mm-hmm. Alexandra Ocasio-Cortez talked in 2018, when she was first elected, about how Democrats don't know how to use social media in order to get votes. Has anything changed in the Democratic Party in terms of trying to find a way to get people who are inclined to progressivism to get the vote?
That's a really good question. I would describe it as yes, better than we were, and no, not nearly as good as we need to be. And I'll give you a very specific example on this. I am an admitted nerd. I love policy. I'm a wonk. I love all the policy stuff. I could come here and put everybody in this room to sleep with policy, and Democrats sometimes do that. And they're good policies. They're policies from the heart. They're policies about trying to make this country work for middle-class families, trying to make this country work for people aspiring to the middle class, trying to make this country work for adults with disabilities, trying to make this country work for little kids who need a boost, not at 5, they need it back at 18 months and 2 years, where we need to make investments. Universal child care, the things we need to do to make this country work better, yes. This is doubling our investment in science, right? The things we need to do to build a country. But you can't put that in a tweet. And you can't force people to sit and listen to you while you go through a very, very, very long list. So this is part of our messaging problem around this. Here's what I think is the good news. The good news is that for all the things that have happened in the last 2 years, and I just want to be blunt, there's really been a lot. And it's kind of easy to miss it because there's so much other stuff going on at the same time. But think about, I talk about the Inflation Reduction Act. We haven't had a corporate tax increase in more than 30 years. I talk about the climate. It's not everything we need to do on climate, but dang, we're having electric school buses all across Massachusetts. They're rolling in. And our kids are not going to be breathing that diesel. Did you know kids breathe more diesel sitting on those damned old buses than they actually do standing on the sidewalk? This is obscene. And that is changing because of money we put in. So lots of things have changed, but the ones that matter most, I think, and I think they're going to be a big deal in the next election, is to talk about the concrete, specific, right now for people. $35 insulin, junk fees, student loan debt cancellation, things that touch people's lives right where they live. And it may not be fancy messaging, but it's the kind that results in, oh yeah, this is something where government is not just on the side of rich folks, not just some distant way off. This is government that makes a difference in my life. For everybody who is paying for expensive cancer drugs or anything about long-term illnesses, man, next year, $2,000, and you're done. You're not going to be paying that kind of money, and that, I think, is going to be the heart if we just keep talking about the same things. At least I hope so. So, I'm going to have to run, but let me say one last thing as we go. I'm so proud to be from Massachusetts. Only on a nice summer afternoon would you find so many people who would come in and sit down and really engage in conversations about the IRS and about how we talk about the future of our country. This is a hard time for America, and we got a lot that's going on. Just the other day I was thinking about the opening lines to Tale of Two Cities. It was the best of times, it was the worst of times. What we're doing right now is going to set our nation on a course for the next 3 generations. And it's all going to turn on what we do basically in the next 18 months or so. I am grateful to be your person in Washington fighting for you and our shared values. Thank you.